Aphorism number 95. In chronic diseases, the investigation of the signs of disease above mentioned and of all others must be pursued as carefully and circumstantially as possible, and the most minute peculiarities must be attended to, partly because in these diseases they are the most characteristic and least resemble those of acute diseases, and if a cure is to be affected they cannot be too accurately noted, partly because the patients become so used to their long sufferings that they pay little or no need to the lesser accessory symptoms, which are often very pregnant with meaning, characteristic, often very useful in determining the choices of the remedy, and regard them almost as a necessary part of their condition, almost as health, the real feeling of which they have well high forgotten in their sometimes 15 to 20 years sufferings, and they can scarcely bring themselves to believe that these accessory symptoms, these greater or lesser deviation from the healthy state, can have any connection with their principal malady. Explanation of 95. In chronic diseases, the investigation of the signs and symptoms of the disease must be followed carefully and, if possible, in different circumstances, and most minute peculiarities must be attended what patient says about his complaint. For example, headache due to lack of sleep. Here, patient will say, "Yesterday I went to attend party, so I came late night." If such circumstances aggravates his complaint, it should be noted, because such minute peculiarities of the symptoms are characteristics of the chronic disease, and they quite differ from that of acute disease. If cure is affected or not achieved in chronic diseases, such a minute peculiarities cannot be noted too accurately, because here patient becomes so used to their long sufferings that they pay little attention to the lesser accessory symptoms, which are often very useful and fruitful to determine the choice of the remedy. Such symptoms are almost very necessary part of their condition of almost as health. They have forgotten their real feelings in their suffering of 15 to 20 years. Patient can't scarcely believe that these accessory symptoms are greater or lesser deviation from their healthy state, and it can have any connection with their principal malady.